Many times we feel like our cultural or traditional practices are very unscientific because we don't know the background about that. During my childhood days, in my neighbor, I witnessed a condition, a situation. A family came for bride search, and in that, a old lady was literally measuring the length and all of the hands, feet, and all. And she was keenly observing how that girl speaks, how is her voice, and how is her gait, and all these things. She was very, keenly she was observing. Many times, when we think of such things, we feel these all are misbeliefs. But when we go into our text, when we look into our Ayurveda Samhitas, we get lots of descriptions. Charkacharya has completely dedicated one chapter like Tulya Gotriyadhyaya. So what Charkacharya says, marriage should happen between male and female of two different gotras. Gotra means it's a what you can call a family tree. Blood relation should not be there. Maybe it's giving idea about avoiding consanguinity. If we go to the Ashtanga Sangraha, Acharya Vagbhat has very nicely explained about how or what and all we need to check or observe while selecting a female for marriage. He says that Asanchari Rogakula Jata Stri means the female whom we are selecting for marriage, in that house, in her house, there should not be any Sanchari Roga or there should not be any transmissible disease. Transmissible means it's not horizontally transmitting, it is vertically transmitting disease. So, asanchari rogakula jata stri. He further goes on explaining, like he says, Sampannam anna avinashta dantoshta karna nasanaka keshastani. He says, the girl should be sampanna. Sampanna means each and every organ or physic or entire anatomy of that girl should be perfect. Anuna avinashta, even slightest deformity should not be there in danta, teeth, osta, lips, karna, ears, nasa, nose, nakha, kesha, sthana, etc. And he goes on explaining in detail about that. When we look into this in current parlance, if we consider the disease like cleft palate, cleft lip, all these give this Ayurveda explanation gives some idea about these kind of diseases which are genetically transmitted, which involve which are genetic disorders. Also, the age is also said. As per Ayurveda, it is said that female of 16 years and male of 25 years. Not exactly necessary that it should be, but in early age, after when they become major, male and female. So in early age, if they marry, they will get good offsprings. So all these references, when we look into all these things, these tell us about something related to genetic is there in Ayurveda. These references are telling us to how to avoid occurrence of new incidents of genetic diseases. So friends, if you are interested in learning what is there about genetics in Ayurveda, watch this video till the end. Namaste friends, myself Dr. Mahesh Savalagimath. I am practicing Ayurveda since 13 years. I am practicing actually Ayurveda dermatology, and welcome to my channel Dr. Mahesh speaking. Though I am interested, though I practice Ayurveda dermatology, but I am very much interested in genetics. So because of that interest, I am making this video. So let us see what is there in Ayurveda about genetics. So first of all, why we need to know about genetics in Ayurveda or any other sciences, why it is important. When we look into Western literatures, Down syndrome, if we read about Down syndrome, it is said that maternal age around 35 years, usually above 35 or around 35, chances of Down babies is high. There are studies in India that state that even a lady of 25 years age can give birth to Down syndrome. Why is these things are happening? There must be some problem. That is why these diseases are happening. When we look into the statistics of birth defects, spontaneous abortions and all these are said to be because of chromosomal deformities. Even growth and developmental disorders that commonly occur are related with genetic disturbance or genetic cause. So what is genetics? I'm not going in detail about this. Genetics is study of genes, or it is study of heredity and its variations. When we look into the genetic diseases, etiology, first of all, when we look into etiology, etiology is said to be largely unknown. So to blame somebody, environmental factors like radiations, virus, chemicals, and other exogenous exposures are considered as the major causes, which have mutagenicity or genotoxicity. They show, so they cause the genetic disorders. So genetic disorders are broadly three types: chromosomal disorders, simply inherited disorders, and multifactorial disorders. Chromosomal disorders are caused due to either lack, excess, or abnormal arrangement of one or other deficient chromosome or genetic material or excessive genetic material. Simply inherited diseases are three: autosomal dominant, autosomal recessive, and X-linked. Multifactorial genetic disorders involve multiple mutant genes, and simultaneously they need multiple other exogenous factors to manifest genotypically. So to manifest as a pathology, they need multiple factors. So that is why they are called as multifactorial genetic disorders. What is the treatment for sex chromosomal disorders? Hormone replacement therapy, which is not so successful. It is tried. Gene therapy is there, which is to replace the defective gene, but because of ethical reasons, this is not practiced. And ultimately, left out thing is prevention, for which genetic counseling is advised. Now we will see what Ayurveda says. What is there in Ayurveda about genetics? First of all, let us see what is Garbha, how Garbha is formed. What our science says: Shukra Shonita Jiva Sanyogetu Khalu Kukshigate Garbhasodhyam Bhavati. Charkacharya says, means when Shukra and Shonita get union of Shukra and Shonita takes place. The Shukra means here we have to consider sperm. Shonita means we have to consider Om or Stri Bija. Shukra as Purusha Bija. When the union of these two takes place, there will be formation of Garbha in the uterus. Okay, this is the definition of Garbha. This is needed, so that is why we are considering. Now let us move to the understanding of genetics. As per my understanding, we can understand, or Ayurveda has explained genetic concepts under three different concepts. The first one is Beejabhaaga and its Avayava concept. The second one is Mahaabhoota concept. And the third one is Svabhaava, which is explained by Sushrutacharya. We will see them one by one. Now first we will consider the concept of Beejabhaaga and its Avayava. So I am going little deep in this, so to make you understand correctly what exactly it is. So when we look into the Garbha Janaka Bhavas, which are responsible for the formation and growth and development of the Garbha, they are 6 in number. They are Matruja Bhavas, Pitruja Bhavas, Atmaja Bhavas, Satmaja Bhavas, Rasada Bhavas, and Sattvaja Bhavas. Okay, like Matrutaha, Pitrutaha, Atmataha, Satmeto, Rasataha, Satvataha, Itatebhyo, Bhavebhyo, Samuditebhyo, Garbha Sambhavati. Means by the union of these 6 factors, the Garbha is formed. While commenting on that, about this, Chakrapani says that Atra yatha matraya chatvaro avashyam garbham prati karanabhuta na tata satme rasova. Means, for the formation of Garbha, Matruja Bhava, Pitruja Bhava, Atmaja Bhava, and Sattvaja Bhavas are important, and Rasaja and Satmaja Bhavas are responsible for the growth and development of the fetus or the Garbha. Now, what are these Matruja Bhavas or Pitruja Bhavas, and from where they come? It is said, Garbhasya yani matrutaha iti means matrutaha, pitrutaha. Matrutaha means maturagata shonita sambhavanti utpadyanti. These are the factors that come from Stri Bija. That is, Shonita means Bija. These factors come from Matruja Bhavas, Matruja Bija. That is through Shonita. And same is true with Pitruja Bhavas. Pitruja Bhavas come from Pitru, that is from the father. So to understand this in detail, we need to understand Angavaya Utpatti, to understand what exactly mean by Matruja Bhava, Pitruja Bhava and all. So Angavaya Utpatti, when we look into that, in the first month of Garbha, the formation of Garbha, what is the state, how it appears, how it will be? Charkacharya says, Sa Sarva Gunavan Garbhatvam Apannaha Pratame Masi Sammurchitaha Sarvadatu Kalushi Kritaha Keta Bhuto Bhavati Avyakta Vigraha Sad Asadbhuta Angavayavaha. It is very important and it has got lots of hidden meanings. What is said? Sarva Gunavan, when all the factors are normal and when Garbha is formed. In the first month, all dhatus will be present like a kalushikrita ketabhut as a single mass. They will be present in the Garbha. In that, what he says, bhavati avyakta vigraha. So there will be no well-defined shape or structure to the Garbha in the first month of pregnancy. Further, he says it will be having Sat Asat Bhuta Angavayavas. Sat means true and Asat means false. Means in the first month of pregnancy, Garbha will be having true Angavayavas and false Angavayavas. What it means? What is the meaning of true and false Angavayavas? Let us see. Well, we go into the commentary of this. It is said, Dhatu Shabdena. It is said here, Sarva Dhatu Kalshikritaha. Dhatu means what? Dhatu Shabdena cha Bhutani Uchyanti. Kyunva Rasadi Bijani. Rasadi Dhatu Bijani. Means, in first month, the Dhatu means Pancha Mahaabhootas will be present. Or, what Acharya further says, Kyunva Rasadi Dhatu Bijani. Or, it contains the seeds or the roots that are responsible for further formation of Rasa Rakta Mamsadi Dhatus, they will be present in Garbha. So further he says, what is the meaning of Sadbhutangavayava, Sadbhutangavayava? He says, Anganam che bija rupataya sthitattvena saptatvam, avyakta bhava asatvam cha. What he says, Anganam cha bija rupataya sthitattvena. All the Angavayavas, as it is said in the organ, origin of organ, Yoga Paddena Abhinirvartate, means all the Angavayavas are formed at once. They all are formed at once at the time of conception. So, what he says, all these Angavayavas, ears, nose, extremities, all the Angavayavas, spleen, kidney, whatever the organs we take in our body, all will be present in Garbha in the form of seeds. In the form of seeds, they will grow and develop into the individual organs. As they are present in the form of seeds, it is said Sat, that is true organs. Avyakta Bhavat, as they are not visible clearly, as they are, in a seed we cannot see a plant, but plant is there in that seed. So seed is there, so that is why it is true. As it is not seen, as those Angavayas are not visible, and they are not defined well, so Asat. So it is said the false Angavayavas. Further, in one commentary we get from Chakraparni says, Evam Manyante. What is the meaning of Stri Bija, Purusha Bija and all? What it means? He says, Manushya Bijam hi Pratyanga Beejabhaaga Samudayatmakam. The Bija, that is what we can consider like as per modern science, sperm and ovum. What these are? These are nothing but the collection of seeds of various organs of our body, various Angavayavas of our body. Swasadrishya Pratyanga Samudaya Purusha Janakam. So, as per the presence of various Angavayavas, Bijas, the seeds of various organs, depending on that, the Garbha is formed. If the seeds of eyes or seeds of sight is there, then the Garbha will have sight. If seeds of sights are not there, the Garbha will become blind. The offspring, the baby that will born will become blind. So what it is said, that the Shukra and Shonita or the Stri Bija and Purusha Bija are nothing but they are the collection of seeds that are going to form various organs of our body. He further said that organ Angavaya Utpatti adds this, as I was telling, Evam Asendriyani, Evam Asendriyani Angavayavascha Yoga Paddena Abhinirvartate. Means all the Indriyas, all the organs, all will be formed at once at the time of conception. Anyatra tepe bhavebhyo ye asya jatottara kalam chayante. Other than those which form or which become visible after birth, jatottara kalam. After the time, after birth, they will be gradually, they become, visible. They form, they take their visible shape. Like tadyata, danta, Vyanjanani, Vyaktibhavas Tata Yuktani Cha Aparani. But he says the occurrence, the origin of teeth which are formed after birth. Vyanjanani. Vyanjanani means mushroom, like mustache, beards, all those things. Vyaktibhava. Vyaktibhava means appearance of menstruation, semen or sperms and all. Tata Yuktani Cha Aparani. These will be present in the Garbha at the time of conception only, but they appear after birth at their particular times. Okay, yesham prakritihi vikritihi punarato anyata. If this happens like this, like danta is formed after birth, then it is called as prakrita. If it is like sometimes we see that no babies are born with teeth, that is called as vikrita. Okay. Santi kalu asmin garbe kechin nitya bhava santi cha anitya kechin. So that is why Charakacharya also says that is why in Garbha we get some organs or some factors which are nitya, that is true, some are anitya because they are true because they are in the form of seed, and as they are not visible, as they are not formed, so they are not true, they are false, anitya. So further he says why jatotra bhavas like vyakti bhavas tata yukrani cha parani. So urayeva he stanarambaka bija yuktam striya uttarakalam stanavat bhavati means in female fetus or in female garbha at the time of conception only when the sex is determined as female there will be Beejabhaagas which are responsible for the occurrence of appearance of breast at puberty. They will be present. So that is why in late after birth at puberty that baby female child develops breast. Evam kapola eva smashru bija yukta smashrubam bhavati. Similarly, if garbha is male garbha is formed at the time of formation of garbha only, the smashru bija, that is mustache, beard and all the seeds for the occurrence of those will be present in garbha, and at puberty at particular time they become visible. I think it is clear here. So further, if when we look into the Artavadushti, there is one condition called as Artavadushti or Artavyapat. There we get detailed explanation. Here he says, Artavam cha yadyapi dvadasha urdhvam vajyate. Though the menstruation starts after or it is visible after 12 years of age, but tathapi artavotpatti garbhakala eva bhavati. But the formation of artava is formed, it takes place at the time of conception only, at the time of formation of garbha only. Yena satam eva artava danta smashru prabhutinam kale kale vyaktirbhavati tena artavarambakasya api bijasya garbha kale pradosha upapannaha. As the time passes, they become visible. Yena satam eva artava danta smashru prabhutinam kale kale vyaktirbhavati. These factors which are jatotra bhavas which appear after birth, they will be formed at the time of the formation of garbha only. But simultaneously, the deformity, if at all anything has to occur in them, that also occurs at the time of conception. Means genetically related arthava vikaras like menstruation problems or what you can call reproductive diseases which are having genetic origin, they all are formed or they all occur at the time of conception only. So to understand it clearly, we get a condition called as Trivyapat. Here, in this, we can very clearly understand how we can, understand genetics in Ayurveda. So in that, there are three conditions. Same is true with Purushavat. So we will discuss only Trivyapat. Yadahi asya shonite garbhashe Beejabhaagaha pradosham apadyate tada vandyam janeti. Means in the Beejabhaaga, means the Bija which is responsible for the formation of garbha. In that, if the Beejabhaaga which is responsible for the formation of garbhashaya, for example, if it is the Stri Bija or Stri Bija, where the garbhashaya Beejabhaaga comes. If we consider this red one as garbhashaya Beejabhaaga, if this is having some deformity, then the baby, that female child that borns will become Vandya, will suffer from infertility because the fertility or the reproductive system has been disturbed or deformed at the time of conception only. Means genetically only it is damaged. Further he says, Yada punarasya shonite garbhashe Beejabhaaga avayava pradosham apadyate tada puti prajam janeti. If at the time of conception in Stri Bija, if Garbhashay Beejabhaaga Avayava means fraction of Garbhashay Beejabhaaga. For example, if we consider red as Garbhashay Beejabhaaga, and if further if we divide them into further fractions as Avayavas, then if Avayava of that, if some part of that Beejabhaaga gets deformity, for example, as I am showing here black, If that gets deformed, then Puti Prajam Janeti, that gives birth to a female who will be having, you know, habitual kind of abortions, frequent abortions. Or Puti Praja means gives birth to dead babies. Means the fertilization takes place, fertility is there, but the uterus cannot hold that fertile, product of fertility or conception for a long time, and that gets aborted. Maybe because Garbhashay is there, but some factors which are responsible for maintenance or withholding that conceptus may be deformed at the time of conception only. So that is why that lady will become Puti Praja. Further he says, Yada tu asya shonite Garbhashay Beejabhaaga Avayava Strikaranam cha Sharira Beejabhaaganam Ekadesha Pradosham Apadyate. Means at the time of conception in Stri Bija, if Garbhashay Beejabhaaga Avayava like this gets deformity, and simultaneously Strikaranam cha Sharira Beejabhaaganam Ekadesha, and Ekadesha means simultaneously, if we consider this purple patch as the Beejabhaaga, which is responsible for the secondary female sexual characters, and in that, if any part of that gets Beejabhaaga, Avayava of that gets deformed, then what is said? Striya akriti bhuvishta astriyam vartam nama janeti, means the Garbha that is formed will be having a female appearance, but that child or that lady after growing will not be a normal female, maybe of hermaphrodite or some that type of deformity may be there. Acharya is telling like that. Stri akriti bhuvishta, dominantly that person is looking like female but not a complete female. Will be having Garbhashay Beejabhaaga Avayava Drishti, so Puti Praja or infertility will be there, and other feminine characters will not be correctly defined. So by this, it's very clear that we can consider that Bija is nothing but Stri Bija or Purusha Bija is nothing but it's a collection of Beejabhaagas which are responsible for the formation of various organs or physiological developments of our body, and Avayavas means fractions of that. Like as I was telling, Garbhashay Beejabhaaga is entire female reproductive system. Beejabhaaga Avayava means maybe it is associated with ovaries or fundus of the uterus or something like that, or physiological actions or physiology of the uterus like that. Okay, so I think here it is clear. Further, for better understanding, we can consider sex determination. What is said? Raktena kanyamadikam putram shukrena. Like if Rakta is dominant, or if Rakta is more, or if Stri Bija is dominant, then Stri Garbha will be formed, and if Pum Bija or Purusha Bija is dominant, then Purusha will be, male baby will be formed. So what is the meaning of this Raktadikya Shukradikya? In Charaka only we get this reference. Tasya ye evam angavayava santishtante ta eva strilingam purushalingam va bibrati, means at the time of conception, what angavayas we are telling, like they are present in the form of seeds, when they are formed, they are only going to determine whether it is female child or male child. Okay, tatra sri purushayor ye vaisheshika bhava pradhana samshayascha guna samshayascha tesham yato bhuyastvam tato anyatara bhavaha, means there will be factors which are pradhana samshaya and guna samshaya. Pradhana samshaya means which come from Mahaabhoota, and Guna Samshaya means which come from Atma. These factors will be coming from Panchamahabhuta and Atma into the Garbha, and they are going to determine the sex of the fetus. If at all it has to be a female child, means what will be Raktadikyata means, he says. Raktadikyata means Klaibyam, Bhirutvam, Avaisharadyam, Moham, Anavasthanam, Adogurutvam, Asahanam, Shaitilyam, Martavam, Garbhashay Beejabhaaga Tata Yuktani Chaprani Strikarani, means these are the factors like Klaibya. Maybe, yes, I don't know whether it will be how correct it is, but what I consider Klaibya and Aklaibya for male Garbha. Maybe it is Klaibya means like XX, Aklaibya means XY. Like what I was telling, these are the bhavas, they will be present at the time of conception. So Klaibya can be considered as XX, sex chromosomes, and Aklaibya can be considered as X and Y as male factors. So if these are present, then it will be a female Garbha. Okay, if opposite are there, Viparitani Purusha Karani, male Garbha will be found. Ubhaya Avayava Napunsaka Karani. If both are mixed type of presentation is there, then that will be leading to a Napunsaka Garbha. Now we'll move to the Mahabhuta concept, second concept. We all know that it is said like Shukra is Soumya, Artava is Agneya, like that. So Sushrutacharya very nicely explained. Soumyam Shukram Artavam Agneyam Itaresham api atra bhutanam sanidhyam asti anuna visheshena parasparopakarat paraspara anugraha paraspara anupraveshacha. But he said Shukra is Soumya, Artava is Agneya, means one is like Jala Mahabhuta, another one is Agni Mahabhuta, if we consider like that. So other Mahabhutas, they too will be present. Itaresham api atra bhutanam sanidhyam asti. Other Mahabhutas will also be there, will be present there. Anuna visheshena. Anuna means in the as a fractions, specific. They are very specific. All like not fractions at specific proportions by paraspara upakara. They will be called what you can call cooperating with each other. That kind of maybe individual Mahabhutas will be having a good kind of cooperation. They mix together. All those things will be in that form. These Mahabhutas will be present. Now, Sushrutacharya also have said that Garbhastu Kalu Antariksha Vaivagni Toya Bhumi Vikaraha Chetanadhishtanam Bhutaha. So means Shaddhatmatmaka Purusha. Garbha is nothing but Atma and remaining Panchamahabhutas. Now, as Acharya have said that Matruja, Pitruja, Sattvaja and all, no? So now he is telling Mahabhutas. That means he adds that Matrujadayo api asya Mahabhuta Vikara eva. Though we have explained that Matrujabhava, Pitrujabhava and all, they are nothing but they too are Mahabhuta Vikaras only. They too are to be treated as Pancha Mahabhutas. They will be responsible for the presence of those Bejas of various Angavayavas. Now further he says in second chapter Sharistana, Garbhasya Chatvari Chaturvidani Bhutani Mata Pitur Sambhavani Ahara Jatani Atma Prakani Cheke Sarvasya Sarvani Bhavanti Dehe, means there will be 16 sources of or 16 types of Mahabhutas which come from 4 different sources. Means 4 Mahabhutas except that of Akasha Mahabhuta, because Akasha has to present. If at all any other Mahabhuta has to be there, means Akasha Mahabhuta must be there. It is not having any specific specificity, so that is why it is excluded. So from where these Mahabhutas come? Garbhasya Chatvari Chaturvidani Bhutani. 4 Mahabhutas come to Garbha from Mata 4, Pitru 4, Ahara 4 and Atma 4. So from these 4 sources, the Mahabhutas come into our body, into the Garbha, and he says, Tesham Visheshat Balavanti Yani Tani Vyavasset Swasadrisha Hetum Sattvam Yatanukam Vyavasset. Means, depending on the amount or permutation, combination or presence or dominance of various Mahabhutas, similar kind of Garbha is formed. If Prithvi Mahabhuta is dominant, so the Garbha will be having the organs which are dominantly having Prithvi Mahabhuta, they will be very strong. Like that, the Garbha will be formed. Now, Chakrapani clarifies that. Chatvari Nirvishesham Akasham Vardhitva. So, Akasha, we cannot exactly tell specifically, we cannot specify the karma of Akasha, so that is why excluding that. Akasha must be present everywhere. So further he says, Matruja Mahabhutas means Matrujani Raktagatani, that come from Sri Bija. Pitru Sambhavani Shukragatani. Pitruja Mahabhutas means they come from the Shukra, that is Purusha Bija. Ahara Janitu Shukra Shomanita Sayog Uttara Kalam Matur Ahara Sambhuta Rasajani. Means Aharaja Mahabhutas means after the formation of Garbha, depending on the diet pattern of the mother, pregnant lady, these Mahabhutas will be coming to our body. Atmajani to Atma Pratibadha Karma Vasha Bhutani Neyani. So these Atmaja Bhavas, they come from Atma Pratibadha Karmas and they come to our Garbha. So these are the 4 sources from where 16 Mahabhutas come or enter into the formation of Garbha. So this is how here also we can consider the things like in this quotation Vishesha Dhyani Balavanti Tani Vyavaset Swasadrusya. It gives idea about active or switched off genes and switched on genes, like where which Mahabhuta is dominant, where which has to be dominant, that will be appearing and others will be silent, like that. Now you will see the concept of Svabhava. It's very simple, short and straightforward. It is explained by Acharya Sushita. He says, Sannivesha Sharinanam Dantanam Patanodbhava Taleshu Asambhavesha Romnam Etat Svabhavataha. Means occurrence or formation of Shariranam, means organs of our various organs of our body. Dantanam Patanodbhavaha, occurrence, origin of formation of Danta and falling of those Danta and occurrence or growth of reoccurrence of permanent teeth, all these. Taleshu Asambho Romnamesha, means no appearance of hair on palm and sole, all these is because of Svabhava. That's what he says. He further says, Anga Pratyanga Nivritti Svabhava Deva Jayate. So formation, development, all the Angavayas takes place as a result of Svabhava. He says Svabhava as the responsible factor. Okay, so these are the three factors or concepts on which we can understand genetics. Now we will see some other aspects with which we can improve our understanding of genetics in Ayurveda. When we look into the diseases, particularly Beejabhaaga Vikaras. In Ashtanga Sangra, we get classification of disease as 7 types. In that, there is Saptavida Kalu Roga Bhavanti, Saha Garbha Jata Pida Kala Prabhava Svabhavaja and all. Total 7. In that, we are concentrating on Sahaja. He further says, Tatra Sahajaha Shukra Artava Doshanuyaha Kushta Arsho Mehadeyaha Pitruja Matrujascha. Means Sahaja Rogas are nothing but these are the diseases that are caused as a result of Shukra Dushti, Artava Dushti, or Stri Bija Dushti and Purusha Bija Dushti. So Stri Bija, Purusha Bija Dushti means some Dushti or some deformity has occurred in the Beejabhaaga Avayavas of various particular organs. So that is why the baby will suffer from those diseases like Kushta, Arsha, etc. So when we go into the understanding further, when we search for the references, we get another reference. Sahi bija doshat ye chapi kechit kulaja vikara bhavanti tamscha pravadanti asadhyan. So bija doshaja rogas means they are nothing, they are called as kulaja vikaras. In the introduction, in the beginning I told asanchari roga kulajata. Kulaja means the disease familial disease, where the disease run in family. So these Bija Vikaras are called as Kulaja Vikaras, and it is said to be, these diseases are said to be asadhya, difficult to manage. So what are the causes for these kind of Bija Vikaras? In Arsha Adhyaya we get these reference. Tatra Tvivido Vijopataptau Hetu Mata Pitrapachara Purokrutam cha Karma Tata Anyesham Api Sarjana Vikaranam. Same is to be considered for other diseases. So what are they? They are Mata Pitru Apachara, means the wrong deeds, the lifestyle, food styles that are wrong food styles, wrong lifestyles, exposure to such things that like genotoxic or mutagenic agents by the parents before the conception or during conception or post conception, in particularly in female, and Purokrutam cha karma, and previous life karma. Now what is the meaning of previous life karma? It's not previous life karma. Like previous life of a baby means it is the life of their parents. It's not the life of that baby, it is the life of their parents. Means the parents, the life that was led by their parents, how the parents' life was there. So some deformity has occurred in them and that is being transferred. So Purokrutam cha karmeti Jayamanasya Sahajarsho Abhinirvartakam Janmantariyam Karmaha, means in previous generation some deformity has been caused. You can consider some mutations or some genetic damage has been caused in previous generation, and that is being transferred. And that is also classified into two. That is Tacha Durbalam, Durbala and Balavan. Durbala and Balavan. Further he says, Tacha Durbalam, San Mata Pitra Apchara Sahitam Bijadushikam Bhavati. If that deformity, in previous generation, some deformity of genetic material has occurred, and if it is Durbala, that requires Mata Pitru Apachara, means there is an inheritance of some damaged genetic material, and to manifest clinically or to manifest phenotypically, the parents have to support. Means if parents involved in such exposure, or if the parents get exposed to such etiological factors which enhance or which support that genetic damage, that DNA damage, then that disease will be formed. Otherwise, disease will not be formed. So that is why it's called as Durbala and requires the support or supporting exposure to further causative factors by the parents. Second one is Balavat. Balavattu vina apachara janakameva bhavati. Balavan, even the parents are indulging in good lifestyle, having a healthy lifestyle, having healthy balanced food style also, the disease will be caused. Means the parental activities, parents practices will not bring any change in that type of DNA damage which is so strong, which is going to manifest phenotypically. What is the samprapti? How this damage occurs? It is explained in Kusta, I think. It is said that there is a question like why all blind couples won't give birth to blind babies? Why all the couples having skin disease won't give birth to the babies with skin disease? So there, while explaining that, Acharya has explained this one. Tatrochite yasya yasya hi angavayavasya बीजे बीजभाग उपतप्तो भवति तस्य तस्य अंगावयवस्य विकृतिर उपजायते न उपजायते अनुपतापा तस्मात् उभयोपपत्तिर अपि अत्र. Means if there is some damage is occurring in particular angavayava, in bija, stri bija or purusha bija, Beejabhaaga of particular anga will be there. So in that, if some deformity is occurring in the at the time of conception or before conception in Shukra and Shoncha separately, then that particular angavayava will form deformed. That will be having that deformity. If that deformity in bija or Beejabhaaga avayava is not occurred, then there will be no disease manifestation. So that is why both can occur. That is what Acharya Charaka says. So in blind couples, if the Beejabhaaga, which is responsible for the formation of eyes and the sight, if that is not affected by anything that is going to cause blindness, then they will give birth to a normal baby with good sight. Even if a couple who are not blind, if in them the Beejabhaaga, which is responsible for the formation of sight and eyes, if that is getting some deformity, even though parents being not blind, their child may become blind. Same is true with skin disease and all. So that is why, as the deformity is there, so diseased baby. If deformity is not there, there is no healthy baby. There will be healthy baby. Like that it is said. What is the nature of these diseases? As in that 7 types of diseases, Sahaja, Kalajata, all those diseases are there. In that, it is said by the Hindu that Rakta Pittadinam Kshiprakaritva Sahajatva Asambhava. He says that Rakta Pitta, like Ashukari diseases, which are very acute diseases, such diseases usually do not have Sahaja nature. Means they do not, such diseases are not seen as Sahaja rogas. Maybe 2 reasons are there. One is, if at all such disease is there, then there will not be complete formation of Garbha and baby may die in the uterus, or as soon as birth the baby dies. So as life is not there, so Chikitsa Shastra is not having any scope, so that is why it is said. Second thing, that may be because these acute diseases, they maybe, as per my understanding, may not in them like Uttara Dhatu Dushanam may not be seen. So that may be the reason why the Ashukari diseases, that Kshipra Rogas, acute disease like Rakta Pitta and all are not having Sahaja. They are not having any like genetic type of pattern. Sadhya Sadhyata, if we consider, these are said to be incurable. These are said to be incurable. Then why we are making so much discussions? Please wait, friends. For everything there will be a solution. Okay, we cannot, like asadhya means we cannot just say okay, it's asadhya, so let it be. It's not like that. So if you are liking this video, please press the like button, and if you are not yet subscribed, please subscribe to my channel for more such videos. So we'll go to that. Why asadhya, and still why we are discussing. So overall, by seeing this, we can say that based on Beejabhaaga and Beejabhaaga Avayava concept, we can say to some extent, this is my understanding, not necessary that it should be true with all. As per my understanding, Beejabhaaga can be considered as whole of a chromosome, And Beejabhaaga Avayava can be considered as fractions of chromosomes, that is nothing but genes. That is what the explanations given in Ayurveda give us, or that is what the explanations tell. The Mahaabhoota concept also holds good if we consider the active and silent genes concept and all, dominance, where what organ is formed, each and every cell has got all the chromosomes responsible for formation of each and every individual. Like a cell which is responsible for formation of epiderm is also having all the chromosomes and genes or genetic material which is responsible for formation of entire a human being. But only those which are responsible for the formation of epiderm, they are active there, others are silent. So that concept, if we consider Mahabhuta concept, 100% holds good. So active and switched off genes holds good for dominance of Mahabhuta as well as Svabhaava. Now, considering the diseases, if we consider simply inherited diseases, we can consider Sahaj, Balavan Purokruta Karmaja Vikaras, because we cannot treat, or we cannot prevent the occurrence of simply inherited disease. It's difficult. So whatever efforts parents do, it's very difficult to prevent the occurrence of the disease. So it can be Saha or Balavan Purokruta Karmaja Sahajarogas, multifactorial genetic disorders, where it is said there will be deformed genetic material that requires parental exposure or further exposures, exogenous factors, to manifest as a disease or as a pathology. So same is true with Durbala Purokruta Karmaja Sahajaroga. So what is said in Durbala, Mata Pitru Apachara Sahita. In presence of Mata Pitru Apachara only, it's going to manifest as a disease. So that is why we can consider multifactorial genetic disorders as that of Durbala Purokruta Karmaja Vikaras. Now MAATRUJAADI means the factors that are dominant in Mata, and PITRUJAADI means that are dominant in Pita, that is Shukra, it's the male Purusha Bija. Now, as I told, there is Asadhya Rogas. So how we can prevent them at least? Prevention is very important. So for that, there is very important concept, the concept of Garbhasthapana. This is very unique for Ayurveda. As per this, we can say that there are drugs in Ayurveda which can even repair the DNA. The damaged DNA can be repaired by using these medicines. So what is Garbhasthapana? It's very beautiful explanation is given by Chakrapani. He says, Samprati Stitasya Garbhasya Garbhopaghataka Bhava Prabhava Kandakatvena Yat Punaha Stitikarakam Tad Garbhasthapana Muchyate. What he says, you have to understand this clearly. Samprati Stitasya Garbhasya means the Garbha which is formed now, already formed. Garbhopaghataka Bhava means the factors which are genotoxic in nature, or which are mutagenic in nature, these are called as Garbhopaghataka Bhavas in Ayurveda. Prabhava means they have brought in their effect. They have already caused the damage in the Garbha or before the formation of Garbha in Stri Bija and Purusha Bija. Now, Kandakatvena Yat Punah Stitikarakam means Kandakatva means eradicating, repairing, removing, correcting. By correcting the damage, Yat Punah Stitikarakam, the one which brings back to normalcy. Sthiti means normalcy, is called as Garbhasthapana. Friends, you have to understand this. This is very important. But he said the Garbhopaghataka Bhavas have already caused the damage, and Garbhasthapana is that karma or such drugs which eradicate, which repair, or which overcome that damage and bring back to the normalcy of that Stri Bija or Purusha Bija or Garbha at the time of formation or in early post fertilization stage. So that is what is Garbhasthapana. And simultaneously, we should not forget about Daurada. As we see Daurada, Pracharasya, Vikaras, you can see most of them or all of them are present day. If we consider, they all are nothing but genetic disorders of current science. So it is very important. So as the diseases are asadhya, is there any hope? Is there any hope? How can we attempt some kind of treatment, at least for prevention. That is what is the best scope of Ayurveda in prevention of genetic diseases. Why? Because even if the asadhya is said, but in Ashtanga you get a reference. Very beautiful. I really like this. Whenever I feel low, I go to this. What is that? Bali Purusha Karahi Daivam Api Ati Vartate. I really like this quote from Ashtanga. It's very positive kind of explanation given by Acharya Vagbhata. Bali Purusha Karahi Daivam Api Ati Vartate means Bali means strong or good. Purushakaraha means human efforts can overcome Daiva. Good human efforts can overcome fate. That is what Purvakrita Karma and all we in Ayurveda we consider them as Daiva Krita. So good human efforts can overcome the Daiva also. So that is why there is scope for prevention of these diseases. So how to correct them? How to prevent these kind of diseases? There is one option to repair the sources. For example, there are 6 sources: Matrujabhava, Pitrujabhava, Satmajabhava, Atmajabhava, Rasaja and Satvaja. Now we have Matrujabhava, Pitrujabhava, Sattvajabhava, Aharajabhava, Rasajabhava and Satmajabhava. In all these 5 are there in our control. Atmajabhava, we don't know. We are not completely understanding what exactly, as per me, what Atmajabhava means what, I am not sure. So other 5 are in our control and we can manage them. Like for example, Matrujadi Bhavas. Garbha Melaka Uttarabha Kalam Satme Rasabhyam Garbha Sehi Pushtyadeyo Jayante. So out of 6, 5. Considering Matrujabhava, Pitrujabhava, Sattvajabhava, Satmajabhava and Rasajabhava. These 5 are there in our control. So how to manage them? Now Matrujabhava, Pitrujabhava means how to repair them? By doing proper shodhana, by advising proper sign, by doing Vajikarana. Vajikarana is not just aphrodisiac, it is an entirely different thing. We need to understand that. And Garbha Samskara and Garbhini Parichaya. By all these, we can repair the Matrujabhavas and Pitrujabhavas. And Nidana Parivachana, avoiding the exposure to mutagenic agents, genotoxic agents, such kind of things. Okay, so that is first. Next comes management of Sattvaja and Atmajabhavas. Atma, not sure, but Daiva Apashraya Sattva Vijaya Chikitsa can be best source. Sattva means the mind factors. So we need to keep, that is why nowadays it's becoming, music therapy, mantra therapy, all these are becoming very famous and popular among the pregnant ladies and all. So that is why, that is nothing but the management of Sattvaja Bhavas. And management of Satmaja and Rasaja Bhavas is very easy because this is 100% in our control. Satmaja and Rasaja Bhavas, they come through our food and lifestyle. So avoiding Garbhopaghātkara Bhavas or Apachara, which are responsible for bringing any kind of genetic damage or genetic deformity, avoiding those things. Adopting Garbhasthapana in the form of diet, in the form of medicine and in lifestyle, and following proper Garbhini Charya. All these will going to manage Satmaja and Rasaja Bhavas. I'm not sure, but if we follow this, we may prevent the genetic disease. If not in first generation, at least in second generation, we can prevent genetic diseases. There is considering like chromosomal diseases. If we consider hypothetical approaches, I'm going to give you whether it is right or wrong, I'm not sure. So there is like what is said, Pancha Mahaabhoota is also there. Concept of Panchamahuta. There is what is said, Punascha Bhuta Janyatvena Abhidanam Anganam Kshaye Vruddhava. So first Charkacharya said that Matruja, Pitruja, Sattvaja, Satmaja and all. Then he further said that Matrujade Api Mahabhuta Vikaraha only he said. So why? These bhavas are further explained as they are nothing but Mahabhutas only. So for explaining that, Chakrapani gives very nice explanation. Punascha Bhuta Janyatvena Abhidanam. Why? Garbha is said to be formed of Mahabhutas because Anganam cha Kshaye Vruddhav means if any Angavayava is malformed, if it is excess formed or if it is less formed, abnormality is there, deformity is there, then Satyam Tatkarna Bhuta Prayoga Pratishedabhyam Vruddhi Kshaya Janana Jnapanartham. So if any Angavayava is malformed, Kshaya is there, then which Mahabhuta is responsible for proper growth and development of that particular Mahabhuta, Prayoga of that Bhuta. Administration of that Bhuta means not like Pancha Mahabhuta means there is a Pancha Mahabhuta concept based on which same thing again, diet modification, medications, all those. So if we do that, so that particular Mahabhuta which is because of less quantity, which anga is avayava or which organ is malformed or which is no kshina, and that if we supplement that anga avayava or that anga avayava may become normal. If excess formed is there, abnormal growth is there, vruddhav pratishedaha. So avoiding the supplementation of that particular Mahabhuta. If we are able to understand which Mahabhuta is responsible for that particular deformity, and if we prevent the further exposure or supplement of that Mahabhuta, so we can control that one. So that is why he says, Vriddhi Kshaya Janana Jnapanartham, to remind us. That is why Acharya said that MAATRUJAADI Bhavas first he said, later he says Mahabhuta Vikara only. So further he says, Yadangam Yadbhuta Prabhavam Tadangam Tadbhuta Pradhanena Dravyena Vardate Kshiyate Cha Tadviparitena. This is very clear. So which anga is form of dominance of which Mahabhuta? By supplementing that Mahabhuta, that anga grows. By avoiding supplement of that Mahabhuta, that anga decreases in size or in growth and development. It's very clear. So based on this, I thought chromosomal disorders can be considered for preventing chromosomal disorders. This type of approach can be, Mahabhuta approach can be considered. I thought like that. So explaining, I'm not sure whether it is 100% we have to go with this or not. That is left to you. Only thing is we need to do further research. We need to do more work on that. Now simply inherited diseases, recessive and new mutations can be overcome by avoiding Garbha Garbhavas or Apachara, proper timely Shodhana in both mother and father, to be mother, to be father, Rasayana, supplementation of Vajikarana, Pumsavana or Garbhastapana, Samskara, Garbha Samskara can be done. Dominant, if it is there, as it is said, Asadhya, but maybe if in 1 or 2 generations if we do this Shodhana, Rasayana, Garbha Samskara and all, and adopt proper Garbhastapana, maybe 3rd, 4th generation that disease may be prevented. So as genetic disease we are thinking, so we should have a long vision, not a short vision. That is very difficult. So multifactorial genetic disorders we need to avoid. They require mutant genes are there or damaged genetic material is there, but that requires exogenous factors, other parental exposure. So avoiding Garbha Garbhavas or Apachara, proper Shodhana, Rasayana, Vajikarana, Pumsavana, Garbhastapana, Garbha Samskara, all these will help to overcome the occurrence of multifactorial genetic diseases. So that is what I wanted to tell. And friends, if you feel this is correct, so what I want to conclude is we have a very rich source of knowledge of genetics in Ayurveda. So we need to elaborate it. We need to study on that. So if we study that, so far what we discussed, based on this, we can say that prevention can be done. Though cure is not possible, but prevention is 100% possible with Ayurvedic principles. So friends, if you like this video, please share this video with all your friends. And if you have any queries, 100% it's an entirely new topic that I am discussing. You may get questions. Please, write your questions to me in comment section, and also your opinions about this video. Please write in the comment section and please share the video to maximum number of Ayurvedic students. Thank you for watching the video. Take care. Happy learning. See you.